Welcome to the show.
Thank you.
If you want to introduce yourself and tell us what you do.
Sure. My name is Kareen Yeung Landerville. I'm an optometrist here in Las Vegas. I practice a type of optometry called optometric vision therapy. We do basically vision development, vision rehabilitation, and enhancement of our visual skills. So it's a specialized part of optometry. So I have a practice here in Las Vegas. We've been here for 2014, so about 7 years. And we just moved to a new space upstairs in the same building. And we've been in practice ever since.
So what is a vision therapist? Or what is vision therapy, I should ask?
Yeah. So vision therapy is a branch of optometry. So basically you being vision physical therapist may understand this. We describe it similar to like a physical therapy, but for the visual system. So we're rehabilitating, developing, or enhancing the visual system. So we do things like an optometric exam, so like a full-on eye exam, just to make sure that everything is proper, the eye structure is healthy, but we also look at the function of the visual system. So I tend to look more at how the visual system functions versus structure. So once we know structure is good, we look at function. So we look at different areas of how we bring visual information into our brains, such as eye tracking, eye teaming, eye focusing. We also look at the way you process visual information and how we act upon our visual information. So a phrase that I use quite a bit is vision drives the motor system. So basically that's what we're looking at in terms of vision. And then we will take the patient, if the patient needs it, into our vision therapy room where we practice, where we will do a vision therapy program with them. And it depends on the type of patient. So some people may need more of a development of their visual system. So the children that we see in our office, sometimes they have an eye tracking issue where they skip words or skip lines where they read, or they can't keep their focus, or they lose their focus, things go blurry in and out, or they have a hard time comprehending what they're reading. So we would develop their vision. We sometimes get patients that have more of a injury-based problem. So a traumatic brain injury, such as the concussion, or an acquired injury, such as a stroke, we'll have them come in for vision therapy as well to rehabilitate their visual system. And then our last branch of what we do here in our office is looking at visual enhancement. So sometimes we'll have athletes come in here where they're pretty high functioning already, but there's just something that's a little bit off about their visual system. We look for it, investigate, test for it, and then we enhance their vision based on what we find. So that's in a nutshell what we do here in vision therapy.
It's an excellent explanation. That's very thorough. And I also think people would be surprised to see the breadth of the scope that you have as far as what you are able to treat. I was very impressed with it when you were telling me some of the things that your patients that you've worked with. So what would a session look like when somebody comes in?
So a session, we usually recommend anywhere from, so like an adult, usually about 6 sessions, and then we kind of reevaluate. But if it's a child and we're trying to develop their vision, typically it tends, we run our treatment length about 6 months, up to 9 months. So it really depends on the depth of the problem. So when they come in, we do a little introduction, give a little tour about it, and show the patient all of our tools that we'll be using. We tend to give some home exercises to do just to enhance the process, to enrich the process, because as you know, if you come in and do a session, you're going to learn and rehabilitate those areas. But if we don't practice at home, then it takes just a little bit longer. Of course, you can come in once a week and you'll still get better, but we always encourage some home vision therapy. Then we start the session. Typically, if I'm working with a child, we get the child to understand a little bit about what their visual system is, because we always think that vision is just 20/20. And that's one part of it. There's 17 visual skills that we check here in our office, and 20/20 is only one of those 17 skills. So we kind of educate the patient a little bit, especially if it's a child. Hey, why are you here? What are your goals? What's hard in school? What's hard on the field? What's hard at home in terms of getting your chores done? So we'll ask a little bit about the patient's goals. If it's an adult, obviously the adult's goals are much more defined, and so they will tell us exactly what they want to make better. And then we jump right into the session. So we do a little bit of education. This is your central vision. This is your peripheral vision. This is eye tracking. We'll run through some exercises with the patient with the wonderful tools that we have here in our office. And we explain also to the patient, especially if it's an adult, why are we doing this? What does this work on, and how will this affect you? How will you feel after you finish it? How did you feel after you finish the task? And then this is what to look for the next time we do the task together. And then it's about 55 minutes long. We send home some home therapy, and then we'll see you back the next week.
So you mentioned that there's 17 different skills that you test for in vision. How does one, just like a regular person, know if that's complete, or know just anything about like what, because that's, we tend to consider that 20/20 is the only thing that's important, right? How does one become more aware of those 17 other skills that we might not realize that we do on a daily basis?
Yeah, that's a great question. So when you go to a regular optometrist or an ophthalmologist, they typically look at eyesight, the 20/20. They look at the refraction, which is if you need glasses or not, the eye health of the eyes. And so those are only 3 of the 17 areas that we're looking at. So those other areas include eye tracking, that's being able to track across a page or track a ball across the court. There's eye teaming. You have eye teaming up close, where it's being able to look at something up close and team up your eyes, and then look far and be able to basically unteam your eyes, but also keep things single and clear. You have your focusing system. You have to have focus at near, focus at far. And then you look at processing. So processing is areas like being able to see sames and differences, being able to remember what you saw, remember a string of things that you see, being able to pull out relevant information from a background array of noise, being able to see a whole when given parts. Also, visual motor integration is part of this as well. So being able to see, process, and then do, such as handwriting, eye-hand coordination, just walking down the street, riding a bike. All of those are part of those 17 visual skills that we test here in our office. So a lot of times, to answer your question, people don't quite know that there are 17 skills. They're definitely looking at just, can I see 20/20? Because that's how we test. We're in the pediatrician's office, the kid stands 10 feet away, can you see, can you see? Or the nurse's office, that kind of thing. So to educate us a little bit more, I do educate the optometrists in our area to check this a little bit further, or maybe just ask questions. Especially with children, they don't quite know that something is wrong unless we ask them, or they show almost behavioral signs that there's something wrong, like they'll close one eye, or they'll lean in really close or get close to the TV. Adults may not know unless they say, hey, I've always had an issue reading and I can't focus, and things go blurry in and out. Wait, that's not typical, that's not normal. And until they talk about it, they're not sure that is something that we can address and fix. So education, I think, for me to educate the public and to talk to more people like you, to get you to understand, get the public to understand that there's more than just 20/20.
I think you shared a story with me too. I'd like you to share is someone who plays sports. So you mentioned one before, which is when you are swinging a baseball bat, which, and this can be even for golfing or softball or any type of swinging sport. How does vision play a role into your performance playing a sport?
Yeah, absolutely. So in vision, so like in baseball, you have to be able to recognize, like say if you're going to hit the pitch, you have to be able to recognize what type of ball is or what type of ball the pitcher is going to pitch at you. It's a very short amount of time that you get to understand what pitch it is, and then be able to make that motor adjustment to hit that type of pitch. So you have to have very good visual acuity. You also have to have good dynamic acuity, which is being able to see something specific as it's moving. So that's a type of sports enhancement that we do, is to get people to see clearly, not with a static target, but with a dynamic target, something that's moving. So we'll look at those types of skills in an athlete. In 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 basketball, for example, we have to be very aware of our peripheral vision. In basketball, there's a lot of movement around the player. So we would look at central peripheral awareness. How aware are they of the players around them? How aware are they of the ball, where it is? So not only can you have to see the hoop, you have to be able to judge where you are in space. So the vision drives your motor output. Same thing in like hockey, not hockey, I'm sorry, in golf, like you had mentioned. When you're golfing, you do have to judge space. So judgment of 3D space is very important so that you can, again, look, process, and then make that motor adjustment to be able to say, put the ball into the hole. So there's a lot of things that we look at in terms of vision input that affects our processing, which then affects our output. So again, vision drives our motor system.
When you talk about eye dominance as well in those particular sports, you want to talk about how that affects how
Yeah,
one looks and
yeah.
insight into that.
So for some of my baseball players, if they are batting right and they have a right eye dominance, that helps. Or, I'm sorry, they have a left eye dominance. Sorry, they're batting right and they have a left eye dominance that will help them recognize the pitch faster than if they were right eye dominant, just because of the way that the head is tilted and facing the pitcher. Now, in those cases, I ask the player and the coach, do they have a different type of stance when they are at the batter's box? So if they're more of a sideways type of stance and they are right eye dominant, it's going to be not as effective for the player to recognize the pitch quickly. So then we would ask the coaches to practice a little bit more of a center stance. And I can't remember the technical terms of like what type of stance it is, but it's more of where the body is facing the pitcher a little bit more than having just the left eye facing if they are right eye dominant. So being cross dominant in baseball is actually a better thing. So if you are right-handed, but you're left eye dominant, it would be easier for you to recognize the pitches. So eye dominance can be affected in baseball. Trying to think like there's another sport that it would have a big effect. Shooting sports obviously would eye dominance would be a big part in shooting sports too.
And you said you work with some police to help with that as well, right?
I did. Well, I haven't worked with them directly. I did have a policeman. I've had at least 2 or 3 police officers in vision therapy where we were working on other things with them. But yes, I've discussed it with some police officers.
And going through the spectrum, right, you pretty much see a large development span of those individuals. So, and as you mentioned, you have 3 different kind of genres that you generally
Mhm.
work with. Do you want to go into from a development standpoint, and we'll go to the other ones, and what kind of symptoms or things that you notice or maybe parents can be more aware of, just to know like this is not normal? What kinds of things should I look out for in order to be like, okay, I noticed this, but who do I go for? Or like, how do I identify that this is even an issue?
Yeah. So for parents, we typically see kids that are going into 3rd grade. That's a very popular age group that we see, the 8 and 9-year-olds. And the reason for that is if there's an underlying vision issue, typically in kinder, first, second grade, the child can use other cues to figure out how to get around their vision issue. So for example, if they're reading in first and second grade, the print is very large. There are context cues from the pictures in the book. A lot of times the teachers are still reading to the students, so they may rely a little bit more on the auditory system. When they get into third grade, all of a sudden the demands are changing. So the print gets smaller, there's less context on the page, they're reading chapter books, there's more independence that the teacher that gives to the child. So we get kids and parents coming in where the parent says, oh my gosh, they were straight A students in first and second grade, and all of a sudden in third grade, everything has gone down. So one of the great things is that teachers will say, hey, let's just get those eyes checked. And so that's a wonderful first step, just to make sure there's no a lot of farsightedness, astigmatism, or nearsightedness that could be interfering. So just getting the child to see clearly can help quite a bit. And then if they see an optometrist here in town that is aware of vision therapy or vision related issues to learning, then they could screen for some of these things. For parents, I always tell them to look for odd behaviors. So behaviors such as, closing one eye when they're reading, or leaning in really close and just using one eye. So those are more obvious, or coming close to TV. But other not so obvious signs are things like they were really interested in reading and all of a sudden they're not. Or they have a short attention span, like, oh, he just pays attention for a little bit and then he's done. Or they complain about headaches or even stomach aches, or they just don't want to do it, it's so boring. So these are things that these behaviors that they see that are different than before. And so there could be an underlying vision issue. Kids don't report things that they don't know, like I mentioned before. So sometimes kids are just like, well, of course everybody sees blurry. Of course everybody sees double. And parents are floored when I ask them, do you see double, or do you see things kind of moving on a page when you read? And the kid in the chair says, oh yeah, all the time. And the parents are sitting there like, whoa, you never told me that. And I tell them, well, it's because we don't ask them. And the kids think that everybody sees the same way that they do. So just to kind of probe a little bit, and definitely get an eye exam. I recommend eye exams every year, just to make sure that there's nothing going on there. But for parents, really it's more observing behaviors that weren't there before or just seem a little bit atypical.
Since most people don't know that vision therapy exists, like part of why we're doing podcasts and shows like this is so that we can get the word out about what other professionals do. How would you normally receive a referral from somebody? Would they go get their eyes checked first, doing the 20/20 thing first, and then they're like, hey, I noticed that this kid is doing some of the things you've already mentioned?
Yeah, I get the bulk of my the pediatric population that I see in my office, the bulk are from optometrists that screen for vision problems that are affecting their learning. So I get a lot of referrals from them. The other areas, I get a lot of self-referrals. So in this age of the internet, they go online, they'll say vision and learning or vision problems in children. And luckily I have a lot of colleagues, across the country and across the whole entire world, where they put a lot of information on the internet so that parents can search for it. So when things pop up, it leads to some of the organizations that I belong to, so they get more information there. Sometimes parents find me through Facebook, that kind of thing. So we get a lot of self-referrals. We also get referrals from educational therapists, neuropsychologists, sometimes tutors will refer over. So that's basically where we're getting, or word of mouth, which is wonderful. That's the bulk of our pediatric referrals are from there.
Okay, now we'll switch gears into the second population you mentioned, so brain injury is one, concussions, strokes. Those are all, I'd say, three very different topics that we can as nerd out with. But in general, yes. we're talking about the general public. What I think concussion really is a good piece because I think there's a lot better education and there's a little bit more research surrounding concussion. But what are some of the effects after a head injury that things people might not realize that can occur? You want to go into that, especially it's like from a developmental standpoint, if they're kids in like football or something and they're young and developing. Tell us a little bit what can happen to their vision.
Yeah, for sure. So typically, I get my concussion. The bulk of my concussion referrals are from a concussion doctor or a physical therapist who specializes in vestibular therapy. I do get some word of mouth referrals like, oh, so-and-so came to the office and they had a vision issue following concussion and they come into the office as well. So I'm already, when I jump into the care of these concussion patients, I'm already part of this team, which I absolutely love. When I was back on the East Coast, I worked as part of a team quite a bit in TBI therapy and as part of just kids with developmental therapies. And so coming out here to be part of a team is like, oh, this is what I love, because then if there's something that's a little bit out of my lane, like I don't know what's going on, I'm going to refer back to the people that are part of this person's concussion recovery team. So when a patient comes in, typically there is something going on with their vision, but they're usually not able to express it very well because these are either teenagers. I see a lot of teenagers, young adults. They've never experienced this before. So the symptoms are almost very vague, like I can't focus, or things I have a lot of pressure in my head, I have pressure behind my eyes. They'll say it just feels very foggy, nothing's really clear. So it's not a typical, I see dull, or I have a headache, or I have eye strain. There's not very specific types of symptoms, so they're a little bit vague. Some people do tell me, oh, I just can't focus up close, everything's blurry up close, and then when I change my focus to far away, everything's blurry far away. So they're a little bit more specific, but I do get a lot of people that are very vague with their symptoms. But I've heard it all before, so it's great that I can help validate that I've heard this before and I can relate this to what's going on with your vision. So when we do the evaluation, a lot of times there is an eye tracking issue, a little bit of an eye focus problem, and then very commonly a convergence problem, which is being able to get the eyes teamed up close. So once we diagnose that, then we come up with a plan. Sometimes it's specialized glasses, like prism glasses. It could be specialized tints. Different colors of tints on glasses can help people with different types of vision issues. A migraine or a headache type of patient would benefit from a different tint than a person that can't, quote unquote, focus on a page and make things clear on a page. If we don't go glasses, then we go into a vision rehabilitation program, which can last anywhere from 4 weeks to 12 weeks typically. And when working in conjunction with other therapies, such as vestibular therapy, it can go way faster. Like the kids get better so much faster. So it's kind of fun to see these types of concussion patients get their lives back, basically.
That's excellent. When going to your office, you have a lot of interesting tools and toys there to help you along. If you want to describe some of the stuff that people be working with.
Yeah. Well, again, depending on what type of problem the person has, we have, like, I'm just kind of visualizing, like walking through my office. We have 2 giant 3D TVs, or actually 1 3D TV, and then a giant touchscreen TV that hooks up to tablets and computers. And we work on eye-hand coordination. We work on eye tracking, peripheral awareness, central peripheral awareness, or central peripheral integration of your vision. We also work on depth perception, eye teaming, eye focusing with these types of big screen TVs and specialized goggles that you would wear. We also have they're polarized glasses, and then we have red and green glasses where one eye sees red, one eye sees green. And when your eyes work together, then you'll see things in 3D, or you'll see things appear on a page where they may be missing if you're more one eye dominant or not. We have balls hanging from the ceiling where we practice some eye-hand coordination, eye tracking. We have very simple tools, like we have this, it looks like a clock dial, and it's on a piece of plexiglass. But when we use the task, we have them doing eye tracking and touching or reaching out and touching it. So there's a little bit eye-hand coordination. There's visual attention, because they have to pay attention and not lose their place when they're tracking on this little clock dial. We add metronomes, so we add auditory to the visual experience. And then also, once they're ready, we put them on a balance board or a balance beam or a walking rail, to add some balance to their tasks, because as you know, in real life, we don't just sit, well, hopefully we don't just sit here and just stare straight ahead, right? We're using our vision in many different ways. So we have also games in here, like especially for kids. I don't pull them out as much for adults, but we do have a lot of games where we shift the way that we play the game, so it becomes more visual versus just playing a game, you know? So like, for example, we have, just trying to think. We have a lot of card games. We have little games where it would look like a toy for you, but what we have them do is, instead of just putting like a peg into the slot, we'd have them hold the peg really close to their ear and then put it in that way, so that it becomes more of an eye-hand task, a fixation task, an eye teaming task, and not just like a fiddling around, let's fit the pieces in type of task.
Looking at your office, it looks fun. I mean, there's a lot of things that are very interactive, and the people get to participate quite a lot in their vision therapy. So I think when they walk in, they'll be surprised, like, oh, there's a lot of different things I get to do here. Of course, depending on what they have and what's going on.
Mm-hmm.
Especially if you have 17 skills to develop, there's a lot.
There is, for sure. Yes, yes. We tend to have a lot of fun. Most, I would say 90%, 80 to 90% of our patients don't want vision therapy to end. So they're like, are you sure we have to go? Are you sure we're going to graduate this week? Even the adults, you know, I think that they're happy to be done working with me, but at the same time, they're like, can we check in every so often? I'm like, yes, door is always open. You can come in anytime.
They'll say, I really need to finish that 3D movie.
That's right. That's right.
Yeah.
Yes. To get the high score. That's a big one for the adults or like the teenagers, especially the athletes. They're like, did we get the highest score? Wait, did I beat my score from last week? So it's a lot of fun.
And that's a great bridge into the third category in performance. What kinds of things do people check in with you about to improve their performance? And what kinds of things, I guess, can people know that, oh, there's something that I can work with somebody about my vision to improve my performance? What are examples of how you would work with somebody?
Yeah. So for enhancement and for performance, I still have them come in for an exam, like they haven't had an eye exam for a while. Just again, I need to make sure that they can see properly, because there are some athletes that are out there and they see 2025, 2030, and then it's not quite clear enough for me, because I want them to see as crisp as possible. So we talk about, usually for athletes, we'll talk about getting them into contact lenses or sports goggles if necessary. So we just want to make sure the eyeballs are healthy, right? Structure first, and then we look at the function. And for some athletes, I'll say for more of the impact athletes, like the football players, the hockey players, they tend to have something already underlying because of the types of injuries that they might have had, or maybe a head bump here and there where it wasn't diagnosed as a concussion, but the lingering effects might be there, or they never developed that type of skill too. So if they have a little bit of development or rehabilitation that they need to do, we'll do that first. But that typically only takes like a couple of sessions. And then we look at enhancement. So for the bulk of my athletes that come in for enhancement, we run, again, an optometric exam, but then we have a couple of tools here where we're looking at vision performance. So specifically eye-hand coordination, reaction time, We look at dynamic vision, we look at peripheral awareness, multiple object tracking to see if they can track multiple objects at once. So we'll run these tests on them to see where they rank against other athletes of the same caliber. So for example, I had a college footballer come in, and he came in and we ran all the tests on him. So I scored him against other footballers that were in college or elite. I can't remember which division I had him in and what position he played. I think he was in midfield. So we looked at all of his skills compared to a person that had the exact same criteria, and then it would rank him. So rank him from 1% to the 99th percentile. So again, with athletes, they're super competitive. So they're seeing that they're only at the 35th percentile compared to somebody else who has exact same credentials as him. He's going to work hard and he's going to want to improve those skills. So I think there's about 10 skills that we look at in terms of a vision enhancement type of athlete, and then we'll work on those. So they come back in, we'll do a session. These are very high level sessions where I'm just like pushing them at the highest level. And then of course we send home the home exercises, typically anywhere from 4 to 6 visits they'll do in office. And then I give them all their tools. We work with a lot of eye-hand coordination and strobe goggles, and we send all of that home. They have all their tools, and then they practice at home with their coaches and their trainers. And again, I always tell them my door's always open. You come back anytime for a tune-up. And I do have some people that come back for tune-ups before like tryouts, a big tournament, playoffs, things like that. So
I think that's
it's
a great
lot
point.
of fun.
No, absolutely. I think, and if that's what someone is reaching to get, that 1% is, that's what's going to drive it, because like you mentioned, your vision drives motor, right? So as much practice as you can, practicing reaction time or your footwork drills or whatever it is for your
Yes.
training, that is probably more important to train nervous system activity, because that's what's going to drive the reaction time, catching a ball, being able to look and be able to find the ball wherever that may be, in the sun or whatever that may be. So I love to hear that, because people just think about physical capabilities of, I need to train harder, train more, when sometimes it's about training smarter or training the thing that's going to make the most impact.
Absolutely. Yeah, absolutely. It's we find that if we have somebody that's performing at 90th percentile, and so like I had a baseball player who was in high school and he wanted to make it to the majors. He was scoring at 90th percentile for most things, but he wants to make it into the majors. So we have to get him to the 99th percentile on everything. So even though, like, if he just wanted to play, high school baseball, 90th would be great. He'd probably be the star of the team, but his goal was to make it to the big leagues. So we had to train him so that he could make it there. And that 9 percentile change in his performance can make a huge difference between, being just a college baseball player versus being drafted. So that's a big selling point for a lot of athletes.
So what's something that you commonly see in your practice that you wish more people knew?
I think for when I first started in doing this, I wish that more people knew about the non-surgical ways of treating eye turns. So an eye turn is called strabismus. And so we get some people coming in that had a strabismus where their eye was out. So, but it was intermittent. It wasn't constantly out. They didn't have an eye turn out all the time, but just sometimes. And so I see people coming into my office where they've had surgery for this. And what complicates about surgery, and my bias is very skewed because I see the cases that don't work. And so I know there are lots of cases that do work, but the ones that don't work, they come in, they've had like 3 or 4 surgeries. Their eyes are really super wonky by this time, and it's much harder to work with them. And when I look at the previous records, it's like, oh, wow, it was only an intermittent eye turn. But because they didn't know about me or no one suggested vision therapy, we couldn't move forward with that type of therapy first before we went into surgery. So that's one thing that really bothers me. And it's not the fault of the parent or the patient or anything, because that's what they're given. It's kind of like what you're saying, we want to make more people aware of what we do so that they do have options. Sometimes vision therapy is not an option. They either don't have the time, or they don't have the finances, or they don't have the commitment to be able to do a therapy program, because when you have an eye turn, it can take anywhere from 6 to 9 months to get the result that we want. And some people just don't have that commitment. So they do turn to surgery, which is totally fine. But I always want them to have that option for themselves.
And what's something you've learned and you wish you knew sooner?
Uh, so on a business side of things, I wish there was some sort of course, like in optometry school, they gave us like a little business side of optometry course, but I don't think I paid attention, and that was so long ago too. So I wish there was, like, nowadays everything is like online like this, which I love. You can take a little course here online or a webinar. I wish they had that back in 2014 when I opened. Just a course to teach me how to run a practice, the business side of things. Um, yeah, and then also to hire a bookkeeper, because I wish I hired a bookkeeper right off the bat.
Things we learn, right?
Right? Yeah.
Speaking of
So
learning,
that's what yeah.
Speaking of learning, you mentioned courses. Is there something that you've been working on, whether it's professionally, personally, physically, or mentally, that you're excited about?
I love attending courses, and I've talked to Erica about this in the past. Like, we love to learn, and the cool thing about being in vision therapy is that it's always changing. It's very progressive. The research is out there, and then, well, the clinical work is out there first, right? And then the research kind of catches up with us. And so once it becomes in the literature, it's like, oh, it's validating what we've been doing, for the last 20 years. But going to these courses and learning from our mentors, that's a big thing for me. I love it. So, the last 2 years, all of our conferences have been canceled or postponed or online. So I'm looking forward to attending. There's a big vision therapy conference in April that they hold every year. So I'm looking forward to going to that one with my staff and learning from the mentors and the people that I bow to, that teach us what they know. I also like to attend. There's a sports vision conference that is held every February, and there's a optometric rehabilitation conference that is held every fall in September. I won't be attending those two this year because I'm going to focus on the vision development one, which is in April. So I do like to attend those conferences because, again, I love to learn, and I don't go to the conferences just to get my hours. I go there to really learn and just to expand my knowledge and then be able to provide better service for my patients. In terms of me teaching or me giving lectures, I've been approached, but I think it's the whole thing about running a practice, right? There's all this that I have to do here that I can't quite give out there yet. But one day I'd love to have an intern, like 1 or 2 interns. I think that would be really fun to have in my office, so that they can learn about vision therapy, again, to promote the practice, to promote the specialty.
Teach them how to do your bookkeeping.
No, right? I still need to
Yeah.
hire a bookkeeper.
Speaking of that, of like interns, so what is the process of becoming? It's a specialty, but tell us more about how that education lies, and actually how maybe rare it is too in the area.
Yeah. So you have to have, I think nowadays you need to have a 4-year bachelor degree, and then you apply to optometry school, and they go to optometry school for 4 years. Usually during the 4th year in most optometry schools, they do rotations where you go into outreach programs for about 3 months. So I did one where I did vision therapy for 3 months, and my other rotations were at Indian Health Service, a clinic in downtown LA, and then one rotation at our school clinic. So I would love to be, one of those clinics that the students come out to. Once you graduate from optometry school, you do have an opportunity to complete a residency. And so these residencies are 1-year programs where you can specialize in areas such as ocular disease, contact lenses, low vision, vision therapy, pediatrics, geriatrics, vision rehabilitation. So there's a lot of different areas that you can subspecialize in after you finish optometry school. And then if you're like for me, I then did additional training at a vision therapy office and worked towards my fellowship. So I have a fellowship in the College of Optometrists in vision development. And basically I did a lot of writing, a lot of papers, and did an oral interview, and then an in-person exam, and then I achieved that fellowship. So that is pretty rare for the state of Nevada. We only have 3 fellows in Nevada, in the entire state, one up in Reno and then 2 down here in Las Vegas. And the other fellow here in Vegas is my associate, Dr. Wright. So we have 2 at my practice, and it's just a way of extending our knowledge, doing that fellowship process. So it's not as common here in Nevada, much more common in like the coastal states, like in California. And when I was in New England, there were a lot of vision therapy doctors out there, a lot of fellows out there. So hopefully, spreading the word and getting more optometrists to consider this field, and then doing, either residency or in-office training, and then completing the fellowship, I think is very valuable for all of us, for the entire, for public health, really.
Well, even then, just talking about your practice, you have like 3 specialties within the subspecialty, right?
Yeah, yeah, and that's all we do at our office too. We don't, we do very little primary care. We do some primary care, some contact lenses, but we don't sell glasses here. So everybody takes their prescriptions out. So it's basically service only here at our office, and it's mostly vision therapy services, basically.
When you're not going to conferences and learning more stuff, what do you like to do for fun in Vegas?
So I was thinking about that. I'm like, what do I do for fun? Honestly, well, I don't have a lot of free time, sadly, but I spend a lot of my time with my family. So I have a 13-year-old daughter. She's very involved in her extracurricular activities. She's in a band, and she dances, and she does ballet, and so there's a lot of my afternoons are spent just kind of driving her around, doing the mom chauffeur thing. I have a dog, so we go out on walks every so often, and I do have a husband at home. So a lot of things are done at home, and I think I'm a homebody too. So I spend a lot of time at home watching movies. We do go out to movies every so often. Always love catching, a Golden Knights game if I can. And then I do like going down to the Bellagio just to see the conservatory when they change it.
Oh, yeah. Mhm.
And then probably just going out to eat. Yeah, drinking coffee in the morning, that kind of thing. So I'm a bit of a homebody. I'm not that interesting.
How about favorite restaurants in Vegas?
Oh, goodness. That's so funny. Like, people will ask me that, and I really don't know, because I do a lot of cooking at home, only because it's easier for me, and then when I don't cook, we just, quick takeout, like just around our areas. I do like the smaller places, the mom and pop places. but yeah, just like just the little eateries around my house. And I live in the Southwest, so there's a lot of eateries down there. And so it's like I can pick a new place probably, every day of the week and never hit all the restaurants.
Oh, for sure. Yeah, there's so many choices too. It's
Yeah,
amazing.
it's
It's really
crazy.
surprising.
Yeah.
And what do you want to leave the listeners with?
What do I don't want to leave the listeners with?
Mhm.
Um, Goodness. Just to think about your vision. A lot of times we take our vision for granted. We see well, or we put our glasses on, or we put our contacts on, and we see fine, and then we just kind of go about our day. Uh, but if there is something that you struggle with, or your child struggles with, get it checked out. Again, go to your optometrist and get a nice, thorough exam, and then ask questions at the optometrist, like, is this normal? Is this something that we should look into? And then get a referral here. You can also self-refer. If you go onto my website, I have some checklists on my website that asks if you have a vision problem, post-concussion, post-TBI, post-stroke. If you have vision problems as a child, asking your child if they have any of these problems, just starting that conversation. And then as an adult that may have had struggles, like for myself, I never really read fast. Like my reading was always a little bit slower. I kind of saw intermittent blurry vision when I read, but I just was like, oh, it's fine. Everybody does this. And it wasn't until optometry school that I found out that I do have a vision issue, and I had some depth perception problems, and my eyes actually overcrossed a little bit. And I didn't find this out until optometry school. So I just kind of basically, compensated for it for so many years. I did get treated, and I did vision therapy myself, and reading is a lot easier. I focus a lot better. The things don't go blurry in and out, even though I've hit that age where I do need some reading glasses. But asking questions, and exploring and thinking, and just seeing if there's anything else you can do for your vision. For athletes, it's the same thing. It's, is your reaction time just a little bit off? Or do you tend to hit the pitch early, or do you swing late? Are you hitting the rim of the basketball hoop too much in the front? Are you hitting the rim all the time? Are you hitting the backboard too much? Are you not noticing the players around you? Are you, do you feel like you whiffed the ball a little bit too much, or you're not judging where the ball comes to you as you're making a catch? So there's like just this little bit of like, there might be a good adjustment that I could make. And even though I practice 5 days a week and I'm still not making this progress, it might be something to do with your vision. So I just ask questions, really ask questions and explore your vision, and don't take your vision for granted. And it's not always just 20/20.
I love that. And you mentioned your website. Can you tell us more about how people can find you?
Oh, sure. So my website is lvcvt.com, Larry Cat, Victor Cat, Tom.com. Or if you just Google Las Vegas Center for Vision Therapy, that's my website. You can also find me on Instagram. It's at Las Vegas Vision Therapy, or on Facebook. I do have a Twitter that's not quite that updated, but the Twitter is Las Vegas VT. You can also call or text our phone line. Our phone is the same thing as our text, and it goes to the front desk. But then after hours, it does go to my phone too. So I'm pretty reachable. We're up in the Summerlin area-ish. So we're off Summerlin Parkway in North Buffalo, in a big 4-story building. So definitely reach out, ask questions, email us. You can find our email on our website as well.
I really appreciate you being on the show. We learned a lot. It's been very entertaining.
Thank you. Thank you for having me.
Thank you, Dr. Landerville.
Thank you.
Thank you.
We'd like to thank you for listening to La Vida Las Vegas podcast. We hope you enjoyed the time with our guest as much as we did. It would help us out so much if you could share, subscribe, or review our podcast, or any combination of the three. Thanks again, and remember to take care of yourself.